Good day, this is Dr. Mignodel Morales of the Philippines. It's my honor to share with you my research study entitled Effectiveness of Psychological Program in Hospitals in Batangas, Philippines. I'm currently the Assistant Professor in College of Nursing of Lyceum of the Philippines University, Batangas, Philippines. Lyceum of the Philippines University Batangas is one of the premier university in the Philippines. One of the flagship of this university are in healthcare programs which is internationally recognized and produce top-notchers on their respective board examinations. And their graduates now lead the healthcare industries locally and abroad. For COVID-19 disrupts the world, not only in physiologic health, but also in other realms of human being. It includes psychological disequilibrium and social disruption, which is vital in the operation of healthcare organizations. These are being addressed by the different psychosocial programs initiated across the healthcare institution. There were incidents of mental disorders that emerged at the advent of pandemic, which includes anxiety, depression, suicide, and even substance abuse disorder. These disorders triggered by the pandemic should be addressed by the healthcare administrators for not to disrupt operation and to diminish the quality and safe delivery of care. One of the high risk for mental disequilibrium is our healthcare workers because they are the frontliners in this pandemic. They also have families to protect and to add the burden from the stigma and discrimination of the society. The initial response of the society during pandemic was to isolate the healthcare workers whom they believe are the carriers of the virus, which made the situation worse for the nurses and the other healthcare providers. In line with the Republic Act 11036 or the Philippine Mental Health Act implementation, one of the objectives of this law is to integrate strategies promoting mental health in educational institutions, workplaces, and communities. Mental health services shall be accessible, available, affordable, and acceptable, delivered by an adequate number of competent healthcare workers who have been trained to provide mental health care according to their level and setting. These indicators affect the quality of life, morbidity, mortality, and life expectancy directly and indirectly, according to SmartDis 2019. There were anecdotal reports of nurses experiencing mental health issues, such as depression and anxiety, also observed by the researcher from the nurses in the clinical areas in Batangas. They shared that anxiety and depression limit their clinical function and highlighted these times of pandemic. They expressed that their hospital were focused on the quarantine facilities, isolation processes, and treatment among their nurses. Their mental health had been not prioritized and focused on. These efforts had been visible across the country, not only dealing with the increasing cases of COVID-19 and the volume of severe cases, but also addressing mental health issues in the Philippines. Based on the experience and observation of the researcher, there were commendable initiatives of the hospital in collaboration with their stakeholders, starting from providing residences, necessities, transportation, and also having a hotline and platform for communication regarding their mental health among their staff. The researcher wants to determine the program effectiveness, which is vital in improving and enhancing the program for the welfare of the hospital staff. This diagram had been utilized the World Health Organization Service Organization Pyramid for an optimal mix of services for mental health. This diagram showed that there must be basic knowledge and services on the level of self-care, which is cost-effective and efficient, rather than to increase the level of healthcare due to not managed or not well assessed by the society or the healthcare providers. Promotive and preventive management for mental health is the key for sustainability, and the enforcement of the basic mental health service such as education, surveillance, and risk management approach should be prioritized. The objectives of the study. First is this study determines the effectiveness of the psychological program of selected hospitals in Batangas with the specific objectives to identify the extent of utilization of psychological programs in the hospitals, test the significant relationship between utilization and effectiveness of psychological programs, to recommend a sustainable psychological program plan for hospitals in Batangas. The methodologies. The researcher utilized descriptive correlational study that determines the effectiveness of psychological program in Batangas. The sampling technique used was purposive sampling with the respondents of 163 nurses respondents with the inclusion criteria of the following. Nurse in the hospital in Batangas province with a length of service of 6 months and above, and bedside nurses regardless of area or department. The researcher utilized self-made questionnaire based on the related studies and literature. This is composed of 3 parts: utilization, effectiveness, and recommendation of the nurses. For the statistics, the researcher used weighted mean, ranking, and Spearman Rho for correlational. And for ethics, the researcher observed autonomy, confidentiality in the conduct of this research, and this study had been approved by the Lyceum of the Philippines University Ethics Board. For our results and discussion, Table 1 showed that extent of psychological program utilization in hospitals, which is sometimes with a composite mean of 3.3. In Batangas province, there had been varied psychological interventions implemented by the hospitals, mainly in traditional approaches to mental health such as curative and rehabilitative interventions, which includes referral and seeking professional help. These items had been ranked first and second respectively. Batangas having transitioned to a proactive and promotive approach to mental health, as evidenced by there had been underutilization of social media and hotlines for prompt management and counseling, in the results ranking 7.5 and 9 respectively. Involvement of the support groups and reintegration is also vital for sustainability, which had been not usually utilized or non-existent in the organization. This had been reinforced by the proposal of the respondents to have more comprehensive program involving screening, assessment, and monitoring of the employees regarding their mental health in their respective organizations. This is supported by the systematic review study that found that there was low utilization of mental health services among Filipinos, and its prominent factors include social support and problem severity. This is related to the research due to support system could be considered as their co-workers in the organization, and the severity of problems should be covered in the proper assessment and even annual physical assessment by Martinez 2020. Table 2, effectiveness of psychological program in the hospitals. It showed that the extent of effectiveness of psychological program, which is effective in the composite mean of 3.67, the interventions were effective in promoting and enhancing mental health awareness in the healthcare organization in Batangas. Moreover, the first ranked item was regarding family reintegration through communication and followed by recognition among healthcare providers. This is very evident in the Philippines and Batangas. In Batangas cultures, nurses value their family, and having constant communication with them is like a stress reliever. The second effective intervention based on the study was recognition among healthcare providers, which is not only limited to monetary incentives, but the recognition of their effort and worth in the healthcare organization. And for the third, correlation between paired variables of psychological program, Table 3 shows that the correlation between the extent of utilization and effectiveness of psychological program, which yield the p-value of 0.00 with a verbal interpretation of highly significant, utilizing the existing interventions for psychological health resulted in a more effective intervention. However, there had been discrepancies in the interventions, highly utilized and effective, which might affect the sustainability and acceptability of healthcare providers. Healthcare organizations need to plan for screening for mental health issues and treatment, including counseling, should be made available, which based on the utilization rank low. Moreover, staying informed of the current data information of being aware of the risk to themselves and others while caring for the patient with the virus was also emphasized, but in this study had been underutilized. By monitoring and enacting strategies to reduce stress and develop support system, staff can minimize long-term impact. Another research support that there should be an establishment of psychological coping task forces and setting up psychological support platform to provide community support for healthcare professionals, which may contribute to the fulfillment the needs of nurses and protecting their mental health by Sue 2021. For our conclusion and recommendations, psychological health must be prioritized in these times of pandemic in every healthcare organization. The utilization of psychological programs was sometimes used due to limited resources, advanced technology, and manpower allocation. Interventions were focused on the treatment and curative aspects of health, and preventive and curative aspect was often utilized. The effectiveness of psychological interventions depends on the culture and the norms. Filipino nurses viewed family reintegration and communication as highly effective due to its familial inclination and source of social support. However, the promotive and preventive aspect should be on focus, such as social media platforms for mental health awareness, support group creation, and stress management program installation should be included. For our recommendations, the researcher recommends that the psychological program should be made by multidisciplinary team and guided by a specific policy and plan or program approved by the top management. This will create a structure for the organization to follow and evaluate over a period of time. Moreover, the program includes promotive and preventive approaches, strengthening stress management program, more visible mental health education, focusing on self-resiliency, mental health awareness, prevention, creation of support groups per unit, and quarterly psychiatric assessment to enable the staff and the management to intervene promptly as necessary. Employers shall develop appropriate policies and programs on mental health in the workplace, designed to erase mental health issues, correct the stigma and discrimination associated with mental health condition, identify and provide support for the individual at risk, facilitate access to individual with mental health condition for treatment and rehabilitation. Additionally, the research recommends future researchers to utilize qualitative methodology to further explore the challenges of psychosocial implementation in the hospitals. For the limitation of the study, it's only quantitative research, descriptive correlational. For the future researchers, you may want to explore more using qualitative research, phenomenology, an in-depth analysis and interview regarding the whys, the reasons of some of the efficiencies or low-ranking items in our study. Another one is the population. We may shift from the perspective of the nurses to the perspective of the management regarding psychological effectiveness, psychological program effectiveness in their respective organization. And last, the area or the scope. It's only in one province. The researcher recommends that it is to have a wider scope, probably the different provinces under the Calabarzon or the district. For the impact outcome of the study, due to this study, there could be an improvement in terms of the discussion of psychiatric nursing as a course focusing on promotive and preventive aspect of services. This is for the academe. For the administration, is to focus in the risk-based approach and must have structures starting from policies and program instituted, evaluated in the organization. In terms for the community impact or outcome, the community can create a policy paper which affect budget allocation for mental health services for his or her constituents or for the community at large. To end this presentation, I want to quote J.K. Rowling, "Understanding is the first step to acceptance, and only with acceptance can there be recovery." In this quote, I emphasize that we learned now, we understood the gaps and how to address the issues of mental health. Now is the time for collaboration and action to achieve healthy body, healthy mind, and healthy society. These are my references. Maraming salamat. Thank you.